The Indiana Hospital Association has had the Indiana Patient Safety Center in place since 2006. There were a few patient safety coalitions that formed in Indiana back in 2003, 2004, and these coalitions, these early coalitions, came together with dedicated professionals, nurses, doctors, pharmacists, who came together to share information for the purposes of making care safer.
Patient safety is probably the most fundamental responsibility in every hospital, and it's the common thread that every hospital is drawn together on. Our most fundamental responsibility to our patients and the most fundamental part of our mission is to deliver safe and reliable care. It's not only a moral imperative that we have to our patients, but increasingly it's a business imperative.
IHA's Coalition for Care focuses on development of the 11 regional patient safety coalitions because each region throughout the state is different and how care is provided is different throughout those regions.
There should be no barriers from a competitive standpoint or a cultural standpoint to coming and just meeting with peers and understanding each other's struggles. There's a great deal of support.
It gives us the opportunity to learn from other hospitals what works well, what doesn't work well, how we can take small steps to make great changes.
The Partnership for Patients is probably one of the best things that's happened, I think, in healthcare in many years. What it means to me and to our hospital, and I think to every hospital in the country, is collaboration. And one word that describes what the Partnership for Patients is: collaboration.
The Coalition for Care is a very impressive movement in Indiana, and I've had the opportunity in my short time at IHA to attend about half of the patient safety coalitions that were established in the last few years. And I can say that the spirit of collaboration in those coalitions has been remarkable. The participants are most willing to share what works and what doesn't work. They're willing to share their lessons learned, which is extremely valuable to prevent problems and errors from happening in another location.
The listserv is a national listserv, so we are able to see the emails coming from all points in the country related to the projects that we're working on. So on a daily basis, we're able to see that.
The Partnership for Patients has been important to me as an individual because I recognize that we're all human, and the partnership has really given us a platform on a national level as well as a local level where we're able to come together around some really very important things that will help provide a better environment for our patients as well as a more positive and professional environment for our staff members.
One of the areas we've actually put early in our work plan with Partnership for Patients has been early elective deliveries. That was a great place for us to work in because we had wanted to do some team building around nursing and physician partnership in our childbirth area. And in all honesty, it was a place we were pretty successful already. So it gave us a nice firm foundation to practice using the tools to look at our own data and to see that we were really within striking distance of reaching our goals as well. So we started with something that maybe was a little bit easy, but I think that early gain, that early demonstration of what we are capable of doing, I think is going to really pay dividends as we do some of the more difficult Partnership for Patient goals moving forward.
One of the major resources that have been provided to us through the Partnership for Patients is the Lean Six Sigma training, where we train green belts and black belts. And that has provided at no cost to us. And so in our network of 8 hospitals, we're able to send 2 folks for green belt training and 1 person for black belt training. And then once they receive that training, they're going to be focused on the 10 targeted areas under the Partnership for Patients. But after that, there's additional work that those people can do because they now have those skills that will help our patients and our communities.
Data and data reporting play a key role in the success of hospitals individually and working together in coalitions. Collecting data helps track progress over time and shows improvement. And it's a great tool for the hospitals to use to work together as a coalition to help each other with improvement strategies, identifying key processes, and just helping each other in general.
We have multiple tests of change going on, and we're working on all the initiatives, so it's hard to narrow down. I know we've eliminated the early elective deliveries. We've reduced significantly falls. We've reduced hospital-acquired pressure ulcers. We've our CAUTIs, our catheter-associated UTIs, we've decreased those by 94% in the past couple of years.
The Improvement Fellowship has been significant. We've been able to take part of that. We have been able to participate in Hen Week and actually take those toolkits and those hospital sharing stories, bring them back. We have been able to have more than one participant, which is very exciting because we can actually take staff people to this and show them that the improvement can be done.
At one of the coalitions that I attended, a medical director said, "I have a problem where a nurse tried to speak up during surgery and the surgeon didn't listen to her. The nurse spoke up again and the surgeon chose not to listen." And obviously that's a culture issue, but what he brought to that coalition is, can you help me? Can you give me some ideas and some tips on how I can talk to that physician and get his buy-in that says, you know what, that's not acceptable. The nurse has a role in the surgery, and that particular nurse saw that a patient could have been potentially harmed, and she had a right to have her voice heard. And it was just really neat to see the other providers in the room give that medical director some really good advice on how to bring those two individuals together and change the culture within his hospital.
I'm starting to see more clearly how other coalitions have found success and have driven improvement and reduced harm for patients because of this collaboration. And so in our region, as I said, we're fairly early in this work, so we're looking forward, I think, to some real material improvement.
It's important for hospitals to participate in the regional coalitions because it gives them a networking opportunity, and also so we can share and work faster and do improvements faster to improve the quality, which is what the Partnership for Patient program, and one of their goals is to do rapid improvement, to improve the health care and the safety for the residents of the area.
We learn so much from other organizations, and to be able to hear stories from them and to learn what they're doing that has already worked, it just makes things happen much more quickly, I think, in our organization, because we have learned maybe it works at their facility, so we can go ahead and try that at ours.
The advice I'd have for other hospitals and what's worked for us is just to continue to share with one another. Stay focused on the patient. It's not about competing with one another, but helping one another for the sake of the patient.
Our network of regional patient safety coalitions and the fact that they blanket the entire state of Indiana is something that we don't see anywhere else in the country. It gives us an edge. It gives us an edge because of the personal nature and the commitment that they make every day to come not only to their hospitals, but also to share in their communities with their peers the strategies that will drive out harm in our state.